The question of who Endolift is for is one that patients ask very often. At what age can we start? Of course, we always start with adult patients, depending on the problem they come to us with. There is no maximum age at which this procedure should not be performed. Therefore, the procedure has quite a wide range of potential problems it can address, and patients who can benefit from its effects. And most often, this patient is someone over the age of 35. But don't look at it solely in terms of age. It all depends on the patient. To my right is a patient who looks very good, and I won't reveal her age, but it's more than 35 years. And above all, in a patient who takes care of herself, who likes a natural look, when we want to improve the facial contour, improve the neck, the chin, here we can consider the lower eyelid, or off label, work on the upper eyelid. You can also slightly lift the area around the temples, although remember that the procedure must not be performed on the forehead. In this case, this procedure is indicated, and in a moment, we will be performing it on the patient. Additionally, I wanted to mention that we also perform it on patients who want to improve their abdomen, post pregnancy, thighs, buttocks, knees, and above all, they simply want to firm up their skin as well. First of all, the procedure was developed in two protocols, Endolift and Endolift X, where Endolift is primarily used for skin tightening and improving its quality. In the case of my patient, I want to combine these methods. That is, first and foremost, to start with only skin tightening using the Endolift method, and then in small amounts around the jowls, apply Endolift X, where I want to dissolve that slight fat that is located here. The procedure can be performed on women and it can also be performed on men. In the case of men, this procedure is chosen by gentlemen precisely because men want to look natural. They really want no one to notice that these procedures are being done in a regenerative way. And I have to say, I have had the procedure done myself. Endolift, performed by Dr. Ricardo Forte, reduction of fat under the chin. Those who work out know that gender doesn't matter here. Both women and men have a big problem when it comes to reducing that little bit of fat located right under the chin. And men very often also want a procedure that will improve the definition of the jawline. Because regardless of age, everyone wants to look like Brad Pitt. He's already in his 60s, and he still looks really good. So, when it comes to gender issues, we've covered that. But above all, this is for modern patients. Currently, I very often lecture on all things related to modern medicine, modern aesthetic medicine, and the trends that are emerging, especially those outlined in the Galderma Next Company report. So, what will happen in the near future? The report states that the new generation, especially Generation Z, wants to take care of their so called collagen bank. What does this mean? It means that we want to produce as much collagen as possible so that as we age and our collagen decreases, it starts from a larger amount. And I think this is a huge trend, which is exactly what the Endolift procedure addresses. We're also talking about procedures for patients who want to look natural, who are thinking about something like collagen boosters as well. Up until now, this was mainly achievable through autologous procedures. And autologous means, for example, using plasma that comes from our own body. You could say that Endolift is also a kind of autologous procedure because we stimulate our own skin's natural processes. And for some patients, this is the most important thing. They simply want a result that looks natural, that allows them to appear in social settings as someone who has been rejuvenated in a natural, fresh, and healthy way, and at the same time, not to cause a sensation by looking drastically different. So, for these patients, this is exactly the right procedure.